To start with, proctological, none of us in general would become a proctologist so lovingly. I think. If I am right, there are two reasons for that. One is by its nature, the proctological problems are so nasty. Of course, not because of the anatomical regions involved, but because of the characteristics of the problem. Secondly, as you know, the treatment is not easy. Of course, there is a whole lot of options available for us to treat the patient, but eventually, if the outcome is not that satisfactory, what is the use? And very often, even if you intervene, the suffering due to that intervention is much more troublesome than the disease itself. So, to address these two issues, we in Star Care work for quite some time have been pondering on options so that we give patients the best possible results. So that way came the idea of establishing a comprehensive institute of proctology, thereby meaning to provide two things. One is a very experienced senior surgeons team. Second thing, for each patient to choose the best possible intervention or the combination of the possible intervention to give the best outcome to the patient. So that is the idea of having an institute of proctology. It serves the patient not only in the treatment aspect, but also in the preventive as well as rehabilitative aspect of a disease. So, to address the second issue of having a painful outcome from treatment, we have been pondering how to solve it. Of course, inspirational vision of our chairman, we thought of relying on the best possible technology, that is laser. So that is the idea behind the Institute of Proctology with laser as its cutting edge. We have started this program already on the 10th of last month. The response has been so overwhelming, and the outcome also have been quite good. And this program is the second in a series of educative programs of medical fraternity, which is aimed at making ourselves aware of these facilities so that the public benefit. So our program today consists of a talk by Dr. Habib Mohammed, followed by a discussion among the panelists, and lastly by a short brief session of question and answer. So now it is my duty to welcome our Honorable Chairman and Consultant Anesthesiologist, Dr. Sadiq Kodakar, onto the desk. In fact, his whole